Welcome to Malawi. Malawi is known as the warm heart of Africa, and it's the people of Malawi that make it so. We fell in love with the people here. What started as an adoption process for us quickly turned into so much more. God had so much more in store for us right here. We developed real friendships, developed real relationships in the community, and started to see the needs that the community had. For instance, right here where I'm standing, the people that live here, they would have to walk over this mountain to get to the nearest hospital, and that's not okay with us. So we started working with the local government to build a hospital right here in this area, and I'd love to show it to you. So as we get close to the hospital, I'll show you everything that's been done to this point, but I'll also walk you around and give you an idea of what the plans are that we have for the future. So as you begin to see, we're in a rural setting amongst families with gardens and things like that. And just up ahead here is our hospital. So if you want, you can come with me and I'll show you around. And welcome to our hospital here in rural Malawi in a village known as Chipande. This hospital is actually up and running. It started operating and seeing patients in January of 2025. We're here after hours, which is why you don't see any patients here, but normally this is stocked full of people waiting to receive care. If you come with me, I'll show you the main infrastructures and then I'll show you what we have planned for the future. This building here is our outpatient clinic. This is where we see everybody of all ages. We see them here and we have all the medicines here on site. We can dress wounds, we can set bones, we can take care of malaria testing or any kind of sickness diagnostics that we can do here. And then we have a pharmacy located right here on site so that people can come into this facility, get the care that they need and the medicines they need and be on their way. This building next to us here is specifically our pediatric clinic. This is for everybody under 5. We have all our vaccines here for the children, everything that's needed to take care of the kids as they're growing up. We have right here on site and available every single day. And then the way that they do things here in Malawi is if over here you take a look, we have some housing. So there's enough to serve 4 families that can stay here. These are our doctors that are in charge, our head nurses. And so even though our facility is actually Monday through Friday, just a normal working day, because our crucial staff is living here on site, any emergencies that pop up outside of those normal operating hours, the staff is still here and can give 24/7 access to healthcare if need be. So everything that we've looked at so far has been part of our phase 1 of construction, and that gets our facility open and seeing patients. Everything that I'm going to show you from here on out is phase 2 and beyond. This is what we are currently working on and what we hope to be doing in the future. So as we turn this corner, you can begin to see the structure ahead that we've began. This is our maternity center. So this huge facility here will be able to serve so many people right here in this community. It's such a need that we have here. We have too many babies and too many mothers that pass away during childbirth just because of lack of proper child care facilities. So with this structure going in, we're going to be able to serve the mothers and the families in this community really well. It's got all the needed components. Everything that we do here, we work together hand in hand with the local health officials that give us direction on how to build things. And then everything that you've seen so far has been built by this community. So this community is pouring their heart and their soul, their blood, sweat, and tears into this facility. There's so much love and security just in having the community behind this project here. So you can see really how large this facility is, how many rooms it has, how much space it has to really be a modern place for this community to be able to have everything taken care of for the mothers. As we exit out the back here, I want to talk about some stuff that isn't quite built yet, but these are plans that we have. Here at this property, we actually have plenty of land still available. We own all of this land that the hospital's on, even this area here and down the hill. This is all a part of the property that we have here to work with at the clinic, at our hospital. It sits on top of a beautiful mountain here where you can overlook the whole valley. It really is a beautiful place up here. So as you stand quite literally on top of the mountain, I want to just point some things out so that you understand what you're looking at. Here's our maternity center that's currently in progress. In this area here, we're going to have a shelter built for people that are taking care of patients in Malawi. The hospitals don't provide food and they don't provide laundering services for the patients. That's something that you would bring a family member from home to stay with you while you're in the hospital to help you take care of those daily needs. So this will be a structure that'll be built back here. It's called a guardian shelter. This will be a place where they can prepare meals, they can do all the laundry, and they can have a nice place to sleep while they're taking care of their family members here at the hospital. Also, these beautiful rocks that we're standing on, this whole area looked just like this before we got started. All of this land that's been leveled out has been leveled out by hand. The Malawian people are very, very, very hardworking people, and they come in, they've dug all the footers, they've leveled off all the land by hand with wheelbarrows, buckets, picks, and hoes. They're taking all these rocks out and they're busting them up to use as a decorative retaining wall that moves around our property. And it really is just amazing what the people of Malawi are actually able to do as a community. So this is the space, like I said, there's going to be our surgical theater that's going to sit right in here, and it'll be connected right here on the back side of the maternity facility so that we can really take care of all the needs that arise during the labor process. We're also going to be adding 2 more sets of staff housing coming down the hill. You can see how these are kind of leveled off going down. We got to add more staff housing because it's got to be able to house the crucial staff that are going to be working here at the maternity center. So that way we can have that 24/7 care that happens for these ladies while they're waiting to give birth or post delivery processes. So everything that I've shown you now, this is phase 2. Our phase 2 is really this maternity process, taking care of all the maternal needs and getting all of these systems in place so that we can open this facility up and begin to serve this community in such a real needed way. After that's complete, we have phase 3. Phase 3 is going to be all our final things as we're putting the ribbon on the package here. We're going to be wrapping this whole structure in a perimeter wall just so that we could designate where the public should stay out of, just for safety and security, so that way there's no sickness being shared between the general public, as well as any kind of tertiary buildings that are going in place. Let's say we want to put in a dental clinic. We'll be putting those facilities down here. Also, HIV and AIDS is a real pandemic here across most of Africa. And so we need facilities just to address those issues that are separate and private. Right now we have a small area that's already operating so that we can see those patients as needed, but we want to be able to create a place for them where they can get the care that they deserve. We want to be able to love and show the love of Christ to those people as well and give them everything that they need to really succeed. So we'll be adding another separate standalone building for that. And then also up in front of the maternity where it's at now, we envision having a multi-bed long-term hospital facility there. Now that we have the surgical theater in place, we'll be able to do surgeries not only for the mothers who are giving birth, but we'll also be able to do surgeries for anyone throughout the community. So if we have that long-term stay facility, we'll be able to perform major surgeries here and keep those patients for a longer term, so that we can make sure that everything is good, and this whole facility will begin to serve the whole individual right here in this beautiful rural setting, we'll be able to take care of everything that the community has need, and there will be no need for them to try to get to another facility that honestly is just too far for them to make it. So this is our dreams, this is our desires, this is what God has laid on our hearts. And we wanted to show that and lay that out for you. We've had people that really didn't understand the full picture here, but all of this is planned out with such great detail. We work hand in hand with the local health officials so that we're building everything to the specs that they deem necessary. We're also stocking this facility with medicines from the government, and all our salaries are actually paid by the government. So when you give to a project like this, this is just a one-time project where we can invest in this community in a responsible way to be able to provide an economic stimulus to this community, but it's not a long-term commitment. We're working hand in hand with the government and the people of Malawi, and we're making sure that they're running it well and that this community is set up for the long haul. We want this facility, we want this community to outlive all of us. Thank you so much for coming along as I showed you around our facility here in Chipande. I just want to ask that you would prayerfully consider what God can do through you as you partner with us now. We've done so much to this point, but we have so much more to come. So would you consider partnering with us to help see the rest of this facility be completed and change even more lives?